All right, good morning, everybody, and welcome to the first grand rounds of the new academic year. Just to start off with, I wanted to say that it has been a privilege to have been course chair for Semel Grand Rounds for the past 6 years. And as of July 1st, Dr. Sabrina Reed will be stepping into that role and will oversee the planning of the series. Dr. Reed has an extensive background in medical education and currently serves as the Associate Vice Chair for Education for our department as well. I'm very excited to have Dr. Reed at the helm, so please join me in welcoming her to this role.
Yeah.
And without further ado, I'll turn it over to Dr. Nguyen to introduce this morning's speaker.
Good morning, everyone. I'm Dr. Sarah Nguyen. I'm one of the associate program directors and a geriatric psychiatrist in our division, and I am honored to introduce Dr. Lavretsky today. As a geriatric psychiatrist, Dr. Lavretsky is one of the leaders in the field, and I have been fortunate enough to have her as a mentor since before joining faculty here at UCLA in 2019. She has been an advocate and trailblazer in our field, and I am so excited to hear today's talk on brain health and the cutting edge updates and research that Dr. Lavretsky has been involved with. Dr. Lavretsky is a professor in residence in the UCLA Department of Psychiatry and the director of research for the UCLA Integrative Medicine Collaborative, as well as the director of the Integrative Psychiatry and Long COVID clinical and research programs with the federally funded research program in integrative mental health. She is a recipient of 4 Career Development Awards from the NIMH-NIH and the NCCIH-NIH and other prestigious research awards. Her current research studies include investigation of novel therapeutic options for mood, pain, and cognitive disorders in older adults and long COVID. She is the Distinguished Fellow of the American Psychiatric Association, the American Association for Geriatric Psychiatry, and the Fellow of the American College of Neuropsychopharmacology. She is also the recipient of the Distinguished Investigator Award for Research for the American College of Psychiatrists and the American Association for Geriatric Psychiatry. The list continues. She's also the Jack Weinberg Award for Geriatric Psychiatry from the APA. And she is the immediate past president of the American Association for Geriatric Psychiatry. She is one of the leaders for the American Brain Coalition that includes the AARP, American Heart Association, Alzheimer's Association, American Academy of Neurology, and others. She also serves on the Advisory Research Council to the National Center for Complementary and Integrative Health. So please join me in welcoming Dr. Lavretsky.
Okay, thank you very much. This is an unusual situation of hybrid grand rounds where the majority is on Zoom. So, but I'll be speaking to everybody. I hope you notice that brain health as a concept is having a moment. And it's a part of the national conversation at the moment when the nation is deciding how much of brain health is needed to serve as the president of the United States. On Sunday, the desperate baby boomers who are aging very rapidly watched the new documentary by Dr. Gupta about last Alzheimer's patient, promising reversal of Alzheimer's disease. And it's after the billions and billions of dollars have been invested in drug development. The therapies are still sparse and very expensive. The care for Alzheimer's disease and dementia are very expensive. And the governments of the world are now establishing policies based on brain health to promote and foster independence and brain health in the rapidly aging population. So I've been involved in this personally as a researcher for the last 15 years. And I'll present some of the data that put me on this path from the initial studies of yoga for stress caregivers, and it continued on for brain conditions like cognitive decline and depression, anxiety, now long COVID and pain, all of which make me realize that brain health is like this determinant. It's a common denominator of multiple disorders that we as psychiatrists share with neurology and other specialties. So we could refer to brain health as a life span determinant of mental health, simply because we're accumulating more data showing that late life brain conditions are determined in utero. Okay, this is my disclosure slide from the grant funding sources and royalties for 4 books addressing these issues I'm going to be discussing today. So I'll talk about the role of brain health in treatment and prevention of mental disorders across lifespan, and discuss some of the mechanisms by which lifestyle factors and mind-body therapies can serve as tools of self-regulation, stress reduction, and promote psychological resilience, brain health, and lead to the overall well-being and flourishing. And then present some of the several results of the studies of yoga and Tai Chi on brain health in older adults with mood and cognitive disorders and in stress dementia caregivers. So this is an unsustainable economic cost that makes governments of the world, including US government, look at brain health policies. And this is the above neck conditions that we share with other specialties, neurology and neurosurgery. The top 3 most expensive conditions are neurological, stroke, encephalitis, meningitis, followed by about 15 psychiatric illnesses. And Alzheimer's disease is somewhere in the middle here. Yes, Alzheimer's disease. So this is all psychiatric condition, attention deficit and hyperactivity disorder, anxiety, bipolar, depression, eating disorders, autism spectrum, schizophrenia, all the most expensive disorders to pay for. Pandemic really brought interest, public interest, and political interest to mental health crisis, and the doubling and tripling of the rates of anxiety and depression following pandemic. At the height of the pandemic, the rates of anxiety and depression were quadrupled, 40% compared to 11% pre-COVID. And at this time, it's hovering around 30%, which is still higher. And the burden of the pandemic, ongoing mass disasters will continue raising rates of mental disorders, and dementia will reduce expected lifespan because COVID has this senescence, pro-senescence effect on the brain and the body, and will increase cost of morbidity and disability. So mental health. Okay, so this is the hard problem we're faced with. Global population is aging. Here, the number of children under age 5 is decreasing, and it just crossed paths with the number of people 65 and older that is increasing, meaning that in 20 to 30 years, we'll run out of caregivers to take care of older adults. This is the curve of provided by the CDC and World Health Organization that describes reaction, a universal reaction, physiological reaction to mass disasters of any sort. In fact, it was best studied in climate-based disasters, where pre-disaster there's a certain level of stress, but then disaster hits. For instance, in pandemic, when we talk about pandemic, in months March through June, we were in this heroic phase where there were a lot of deaths, but people were standing together. You might remember images of people, neighbors singing from the balconies or clapping to the frontline workers. But then the chronic stress of dealing with the pandemic and fallout sets in, and disillusionment follows. And then we're still in this reconstruction phase, the 4th phase of reconstruction coming out of pandemic. But, you know, we're bombarded with new mass disasters, fires in California, floods and hurricanes everywhere else. So we just don't know where to run anymore. Here, what comes next is creation of a vulnerable brain. And that occurs with aging, but also it's a cumulative effect. Nothing happens at the age of 65. Everything happens down the road to the age 65. And it's a cumulative effect of cerebrovascular disease, neurodegenerative changes, chronic stress, chronic inflammation that creates this vulnerable brain situation where under stress, chronic stress, it tips over to pathological states like depression or cognitive decline. On the scan here on MRI, you could see vascular changes around the ventricles, and in the white matter here, white spots, where it creates executive dysfunction, anxiety, apathy, and many neuropsychiatric conditions. However, what we do know is that resilience factors like increased social support and participation, increased physical and cognitive engagement, lifestyle factors create brain reserve that could protect and also create resilience, psychological and emotional resilience. So this is the model of stress and health. We're all built to deal with stress, acute and chronic. And in fact, we could adapt pretty easily, but our reaction, our stress response is very individual. That is informed by environmental stressors like work, home, neighborhood, exposure to trauma and abuse, major life events, and then individual differences in genetic and developmental experiences. And behavioral responses are also shaped by our lifestyle choices like dietary, smoking, drinking, exercise, sleep, that shape physiological responses that can help us adapt to chronic stress. Allostasis is a process of maintaining stability in face of adversity, and it leads to adaptation. But when stress becomes too much or too long, we develop maladaptive reaction, or called allostatic load. And allostatic load looks like diseases of aging. It's hypertension, obesity, increased cholesterol and lipids, increased sugar in the blood, cortisol, norepinephrine, epinephrine, and decreased protective substances like HDL cholesterol and DHEAS. And so the answer to all of this is that we need to build resilience. And generally, psychological resilience refers to our ability to recover from adversity and stress. It involves brain neuroplasticity and neuroprotection. It leads to psychological, emotional, cognitive, physical health. And again, the lifestyle medicines factors, sleep, diet, exercise, stress reduction with mind-body interventions, social and intergenerational relationships can help prevent mental and medical disorders that are stress-related and build brain capital. So resilience building interventions exist as a cognitive behavioral therapy type, including well-being therapy, learned optimism training, hardiness training, all of which focus on positive aspects of difficult experiences, thereby promoting more positive perception of challenges. As Sarah said when she introduced me, I now deal with long COVID, a population that is 18 years old and older, and all of them experience this existential crisis. They no longer can function. Their brain is not able to function at the previous level. And I ask them every time I see them, do you see any silver linings in having long COVID? And to my surprise, over 90% can name at least 1 to 2 positive aspects of having long COVID. I was able to slow down. I was able to now pay attention to my needs. I'm able to spend more time relaxing and learning about my connection to my body and regulate my connection. So that's the most common theme in the silver lining of having long COVID. And lifestyle factors such as diet, exercise, spirituality can enhance resilience by creating physical and mental well-being. And I study integrative therapies, a holistic and integrative approach to wellness that encompasses varied approaches to stress reduction and brain health, like yoga, meditation, humor therapy, music therapy, acupuncture, aromatherapy, and massage, and many others. So as I said, during COVID pandemic, people were running around Los Angeles trying to find a mental health practitioner, and they couldn't, because everybody was booked and overwhelmed. And it continues at a slightly lower level, but still demand for mental health professionals is high. So people are interested in how to self-regulate best. They started turning to meditation and breathing practices. We had a fundraiser on breathing, neuroscience of breathing, and it attracted tremendous attention. People want to know how to self-regulate better, because while there's a chaos happening around us, we could find mastery of controlling our own reaction to what's going on around us. So what is brain health? It is a state of brain functioning across cognitive, sensory, social, emotional, behavioral, and motor domains, allowing a person to realize their full potential over the life course, irrespective of the presence or absence of disease, like I gave the example of long COVID. Lifestyle factors can improve lifelong adaptation of brain structure and functioning. And if we have a brain health, we can optimize our mental and physical health and benefit individual and societal well-being. And so on the governmental level, I've seen it from the government of California. US Congress is now interested in the concept of brain health. In fact, in March, they passed bipartisan bill recognizing a US Brain Health Week. And that was amidst of nothing being passed for a long time. As I mentioned in the beginning, brain health doesn't start at the age of 65. It actually starts developing with genetic fetal programming when social determinants of health take this imprint or put an imprint on the fetus, and where poverty, housing, tobacco, and poor diet, drug and alcohol use by the mother would have a negative imprint on genetics and epigenetics of the fetus. In fact, American Heart Association and American Academy of Neurology are now leading this Brain Health Coalition and talk about prevention, primordial prevention with this social determinants of health, determining or imprinting later disorders of the brain. And so NIH is looking at early interventions where environmental toxicities are being addressed in utero. Things like good parenting skills, early home experiences, supporting teaching environment and education can offset early stress and environmental exposures. And throughout early adulthood, antisocial behaviors, drug abuse, exposure to social media now is a risk factor. Vaping, social exclusion, stress, anxiety, depression, and psychiatric illness would lead to this allostatic load and contribute to neuropsychiatric disorders of adulthood and older adulthood. So agencies, NIH and CCIH and the VA started turning to the concept of whole person health. And there we look at different aspects of health. It's not just symptom reduction that psychiatry has been involved most into, but looking at the different aspects of well-being and contributors to personal and brain health at the individual, family, community, population level, trying to pull the equation to the health from the disease condition. That's where the prevention starts, primordial at the population level, and then going to at-risk populations. So this is the 6 pillars of well-being: mental, emotional, physical, social, environmental, and spiritual, all around well-being, and human flourishing, which is a complete goodness of humans across lifespan that includes positive psychological functioning and positive social functioning, along with other basic functioning. And again, optimal brain health would optimize all different aspects of mental, emotional, physical health and well-being. Okay. So as I mentioned, the American Heart Association all of a sudden is bored with heart. They want to own brain health. I've been working with them for the past 5-6 years on developing new guidelines, life essential aid, that now includes sleep health, in addition to diet, physical activity, nicotine exposure, body mass index, blood lipids, glucose, and blood pressure, recommending 7 to 9 hours of sleep. In addition, they added new components of positive and negative psychological health, drawing attention to the need for the assessment and future research and development of interventions based on these components, emphasizing positive psychology, positive health, like positive well-being, gratitude, optimism, sense of purpose, meaning and purpose, and decreasing anxiety, anger. When we looked across all studies in cardiology, basically, heart health, the worst predictor of all bad outcomes, mortality or post-surgical recovery, was pessimism. So if you're born pessimist, or that's your predisposition, the outcomes of every medical outcome in heart disease would be worse compared to those who are optimists, for instance. So if we talk about 6 pillars of brain health, being social, mental engagement, managing stress, ongoing exercise, restorative sleep, eating right, it leads. Okay, so Sabrina needs to log in. So it leads to all the positive outcomes, like overall health, but also societal benefits, reduced healthcare costs, reduced dementia, and economic reduction in economic costs, increase in brain capital. For the past 10 years, we've been writing papers on this idea of brain capital and economic effect of improving brain health. And European Academy of Neurology actually published brain health strategy, because here we try, it has to do with how we are funded for research. We tend to function in silos and never talk to our friends neurologists, for instance, who are interested in very similar disorders and processes, and also divide ourselves to pediatric, adult, and geriatric as if it's different people. But actually, it's one brain, one life, one approach where prevention starts at conception, basically. And there are strategies that we know that can preserve, prevent, and protect brain. And those include, as I said, lifestyle factors, but also prevention of head trauma, treatment of depression, treatment of sensory impairment, hearing or vision, substance abstinence, and treatment of cardiovascular risk factors like hypertension, weight, obesity, cholesterol, and diabetes, creating social, political, economic, environmental, and national security by providing this brain capital. So simple things, like sleeping 7 to 9 hours. Why do we need those? And those are necessary for proper cognitive and behavioral function. Brain reorganizes, recharges itself, and clears toxic waste byproducts. There's increasing data on lymphatics of the brain, where brains are scanned during the night sleep, and they're seen shrinking during sleep. Our brains are very active, trying to, like sponges, expel all the unnecessary byproducts, toxic waste byproducts. So emotion regulation is disrupted with chronic sleep loss, leading to depression, anxiety, anger, aggression, cognitive problems, and behavior. Similar process are occurring with exercise. Recommended time of exercise is 150 minutes, moderate aerobic activities, and 2-3 days of weight training per week. It maintains healthy body and brain, cardiovascular, cerebrovascular risk factors, blood-brain barrier, increases clearance and degradation of aging-related products, and it reduces cognitive impairment, has documented neuroplastic effects on the brain, increase in hippocampus. Diets, Mediterranean dish in mind, compared to the SAD diet or standard American diet, reduces depression and improves cognition by 30%. Intermittent fasting, 12 to 20 hours, reduces cellular aging. Supplements like multivitamin, vitamin D, B, omega-3, and fatty acids, consumption of probiotics, tea, coffee, and alcohol all have some evidence of effect on brain health. Stress reduction via meditation, yoga, tai chi, acupuncture, massage, breath work, being in nature, forest bathing, and beach going. I sent everybody to the beach. Long vacations, it's something that we need to study more. Social support versus loneliness affect brain and mental health, and social support leads to reduction in depression and anxiety. Meaning and purpose, volunteering, and spirituality are tied to positive outcomes in mental health and brain health. Creativity, leisure activities, and expressive arts, again, with some evidence. Here, we have a group interested in breathing. And we studied across species in mice and rats and in humans. So the latest research, so we researched it from the pre-Bertzinger singer in the brainstem projections to locus ceruleus and amygdala and insula, which are centers for interoceptive awareness, awareness of our mind-body well-being, anterior cingulate, emotion regulation, prefrontal cortex, and so forth. And at this point, research shows with the breathing, if you just do 3 breaths, 3-second inhale, 3-second hold, 3-second exhale, 3-second hold, you can harmonize the work of all the brain centers important for emotion regulation. They achieve the state of coherence as well as heart and lung coherence, and documented by HRV measures. And that's how you link slow conscious breath to calming effect in your emotional anxiety, stress. So that's something we're studying and promoting as an immediate technique. That's what I teach my patients to do, breathing techniques. So overall, lifestyle integrative therapies for brain health, like mind-body, dietary, physical activity, body-based, natural products, all have evidence of compression of morbidity if they're added to the standard treatments for psychiatric disorders, improved side effect profile, and documented benefits for cardiometabolic, brain, and vascular health. They also reduce mechanisms of aging. My own studies and others documented reduction in genomic instability, epigenetic expression, telomere lengths, chronic inflammation, cellular senescence, and mitochondrial dysfunction. So as I discussed, we all have this predisposition and situations where we are stressed and we can't control it. It leads to all the adverse effects. But if we plug in mind-body lifestyle therapies in the middle of all that, we can alter neurobiological mechanisms of stress response by altering neural, hormonal, immune, cellular, cardiorespiratory senescence, leading to more resilient outcomes, optimizing mental and physical health. So some of the mechanisms that have been studied, like breathing or yoga, promotes relaxation and decreases sympathetic output, reduces clinical somatic symptoms, benefits anxiety, depression, blood pressure, recovery from immune-mediated diseases, reduces level of inflammatory markers like C-reactive protein, improves vaccine response, reduces stress hormones, reverses cellular senescence, improves oxygenation in the brain and the body, increases blood levels of endorphins and bioreflex sensitivity, improves relaxation based on EEG, alpha and theta activities, and beta, and we've documented direct neuroplastic effects on the brain, increasing gray matter and functional and structural connectivity. We published this paper a while ago, trying to understand how mindfulness-based practices compared to yoga-based practices differ in terms of neural effects. And we're looking at prefrontal cortex here in purple, anterior cingulate, posterior cingulate, striatum, insula, and amygdala, all involved in cognitive processing, emotional processing, and sensory awareness of self. So mindfulness practices activated 4 regions: premotor area, mid-cingulate, angular gyrus, and primary and secondary somatosensory cortices, areas of motor and emotional somatosensory integration, greater awareness of self-consciousness. And yoga activated more 7 centers, and that's probably because yoga has more components. Movement or chanting or visualization. And these are the areas of discernment, memory, and language. All of these practices can be used for therapeutic reason, for at-risk youth, substance abuse, mood disorders, neurological illness, dementia, cognitive decline, and caregiver stress. Here's the first ever study that I performed, yogic meditation, 11-minute long, in family dementia caregivers who were stressed. It was sponsored by the Alzheimer's Research and Prevention Foundation. They practiced for 12 minutes. And if you know anything about caregivers, they're very busy. So they can't go to, they take care of multiple members of the family usually and have 1 or 2 jobs or more, and they're driving. So they can't go to the yoga studio for an hour, but they could find 11 minutes, 12 minutes a day to practice this. Kirtan creates very pleasant, it's like a chanting meditation. Eyes are closed as shown here. and focused on the eyebrow point, which is a common attention point in meditation, and imagining light, white light or golden light coming through the center of the head and coming here. These are mudras. It's like acupressure. You're opening meridians by tapping. And they're chanting Satanama, Satanama, Satanama. This is like, don't worry about it. So that's an accompaniment, musical accompaniment. Satanama, 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 Satanama. Then they whisper Satanama. And they're multitasking, they're visualizing and chanting and tapping at the same time and focusing. So we see this multitasking on the brain scan. First of all, meditation in blue decreased depression and increased resilience. And when it came, but it was in parallel with the control group. The control group was just resting, listening to music. And so psychological function actually was as good with resting and listening to the music. But when it came to cognition, it diverged. So the groups that were, the group members who were meditating achieved better cognitive function, and those in the relaxation group declined. And then telomerase levels increased. This was the first in human study using telomerase that showed that over the course of 8 weeks, telomerase can change with meditation, 11-minute meditation, and benefit the health of telomeres. And telomeres are biomarkers of cellular aging. So it could reverse aging processes, just 11-minute meditation. That sent me on a different path of inquiry. I no longer referred to yoga as stress reduction, but it was a pro-cognitive, pro-brain health exercise, anti-aging exercise. This is, again, a first human study that showed change in gene expression with 11-minute meditation, suppressing about 48 genes in NF-kappa B pathway, which is a pro-inflammatory pathway, and increasing about 16 genes in IRF pathway, which is a antiviral interferon response factor in structuring those effects. When it came to the brain, comparing to non-meditators, it activated anterior cingulate orbitocingulate network. The pink areas show the group differences between the group meditators versus non-meditators. And this is the circuit that is responsible for self-awareness, mind-body awareness. For example, you're paying attention how you tapping or breathing. So that would activate that path. So what I was intrigued by was this cognitive benefit of yoga. We proceeded with the next study where we studied older adults with mild cognitive impairment. And here they came for an hour of yoga administered on campus. And homework was the same, Kirtan Kriya. And then comparison group was memory enhancement training, and that's a gold standard developed by the UCLA Longevity Center. That's something you would do in people who are complaining of memory. You would try to improve their memory. And this particular program improves memory by giving verbal and visual association strategies for memory. And the time spent in practice and homework was exactly the same between the groups. So here the results show that yoga in red shows this increase. So the intervention was 12-week long, and yoga continued to improve until week 24, when memory training declined after we stopped the intervention. Executive function only improved in yoga and not in memory training, and depression improved in yoga, but not in memory training. This is resilience, Davidson resilience scale improved in yoga, but not in memory training. Here's the brain change in functional connectivity in the default mode network. And the default mode network shown in this yellow spots with red spots, identifying these graphs. You know, that's where we see correlation in anterior cingulate frontal medial cortex, posterior cingulate cortex, where connectivity in that that area of the brain is also correlated with verbal memory performance. So it was increase in connectivity also correlated with improved cognitive performance on verbal memory tests. What memory training did, and that's the only finding in the brain, memory training increased hippocampal volume, and yoga didn't. Nothing happened with anterior cingulate. However, yoga increased the concentration of choline on spectroscopy chemical analysis, and memory training showed decline. And choline is a substance chemical that is important for memory. So we just completed a pink brain project, which only studied women 50 plus at high risk for Alzheimer's disease. They're postmenopausal, they're recruited from cardiology clinic with subjective cognitive concerns. They're complaining that their memory is not as good as last year. And we investigated exactly the same comparison, Kundalini Yoga versus memory training, memory performance at 12 and 24 weeks. And the secondary outcomes were mood, resilience, quality of life, biomarkers, inflammatory, and neuroimaging. So they had a lot of vascular risk factors like blood pressure, high cholesterol, obesity. We measured inflammation, and that included all the cytokines and chemokines, 38 of them, RNA sequencing, and derived 5 factors from that analysis. So the groups here did not differ by age, race, education, depression. They were mildly depressed, really not depressed. Resilience, vascular risk factors, and cognition, meaning mental state examination score and cognitive domains. And the effect sizes, which means yoga did perform better, significantly better, was in cerebrovascular risk factors, anxiety, and subjective cognitive decline at 12 and 24 weeks in moderate to strong effect sizes. However, memory training improved performance on objective cognitive performance. Chemokines and cytokine analysis showed that memory training was associated with more inflammatory eotaxin 1 concentration, and it increased over the course of 12 and 24 weeks, but both memory training and yoga showed increased FGF levels at 12 and 24 weeks. FGF2 is a neuroprotective factor upregulated in response to antidepressant administration. In terms of gene expression analysis, gene networks were crossed between mood, circadian rhythm, inflammation, and showed association with subjective cognitive decline. Here's cerebrovascular risk factors and executive function. The kinds of genetic pathways are interferon signaling, cytokine signaling, mostly anti-inflammatory, antiviral genes related to antiviral response. The other thing that we measured that is becoming more available now is peripheral biomarkers for Alzheimer's disease. And you could measure beta amyloid in the blood. And here, A-beta 40 is a protective. A-beta 42 is the more kind of aggressive species linked to Alzheimer's disease pathology on the scan and over course clinical presentation. So here, increase in A-beta 40 was associated with decrease in depression measured on that depression. When it came to the brain, it's more dramatic here. Gray matter volumes were either not changed over the course of 24 weeks, or a decrease or increased in left precentral and lateral occipital cortices here in blue. What was interesting is that memory training declined over time. Here are the mean decline in every group, in every area in blue. When it came to brain connectivity, yoga and memory training showed different types of connectivity with different networks involved. Yoga was greater than MET in terms of connectivity in anterior hippocampal seed, and the default mode network showed significantly greater increases in connectivity with regions mainly in visual systems. And memory activated connectivity in the posterior hippocampal seat to the auditory network and somatosensory network. And that probably has to do with how these interventions are administered, because it's cueing, auditory cueing. So this is another study, Tai Chi for older adults with depression. Tai Chi was added versus health education to the standard antidepressant treatment, whatever it was, and showed over the course of 12 and 24 weeks increase in connectivity in these various areas in the brain: language, visual, orbitofactive, multiple systems in the brain, DMN and auditory. And that increase in connectivity was also correlated with improvements in depression and resilience. This is one of the mechanisms that might explain improvement in emotion regulation by reducing brain response to negative phases or emotional phases, where it's deemed in the Tai Chi group, reduced in the Tai Chi group and increased in the health education in the right fusiform gyrus. So in summary, brain health across lifespan is an important target for treatment and prevention interventions for mental and cognitive disorders across lifespan, really. And mind-body practices, lifestyle practices have found neuroplastic and neuroprotective effects, along with whole health, improved cardiopulmonary function, cellular senescence, immune inflammatory, stress reduction, improved well-being, resilience to stress, and emotion regulation. And those are tools. When I teach a tool of breathing or a meditation, it's a lifelong tool. It's free, doesn't require prescription. They can refer, I mean, breathing is, everybody breathes. So that's like all immediate available to you. It becomes a sustainable development goal. And that's what I see with my work with World Psychiatric Association. And across the board, the governments are getting on board. Finally, psychiatry in the US is picking up as well. The next year's topic for theme for the meeting of American Psychiatric Association is lifestyle psychiatry. So, and that brain health could be considered an important factor on par with good health and well-being. It's a human right. That's another aspect that we started approaching and writing about. And, you know, social determinants of health is one target where we could really improve brain health of the population. So this is my testimony to the Congress that was extremely effective. I did it on Valentine's Day in February, and February 14th. On March 15th, they came up with that resolution that I told you about, recognizing the American Brain Health Week. And we actually have a Brain Health Day, September 25th, 2025, again, bipartisan resolution, recognized Brain Health Day, promoted by the American Academy of Neurology. But this is actually a conglomerate of societies now that is jumping on this brain health wagon. It provides, like DSM-5 provides a common language. It provides a language to work across specialties, across organizations. I work closely with AARP and many other foundations, and ACNP is now also trying to get engaged. We actually submitted a session on brain health there too. We held multiple brain health summits and published documents, Life Course Brain Health as a Determinant of Mental Health. So got very famous around the world, especially India and Pakistan, rejoiced. And again, you know, I work with a lot of people across specialties and departments. I like this collaborative network. It requires a lot of people to make it successful, and especially postdoctoral students who published a lot of papers. Thank you very much. Some of them are on this picture. Thank you.
Thank you so much, Dr. Lavretsky, for such an interesting talk, reminding us about the power of positive psychology and brain health. I think we have a couple of questions here. So Do you think that you can comment on the role of environmental contamination and food industry adulteration of the food chain in brain health?
Yeah, I eat organic. That's my response. Natural, organic, not using processed food as much as possible, whole food diets. Following Mediterranean diet is really my advice because it's well balanced. It's based in good fats. Good fats are extremely important for brain health, like olive oil and fish oil, whatever. If you're vegan or vegetarian, you might alter it.
Thank you so much. And this is another question that I had a similar question, but did lack of traditional religious practices correlate with increased pessimism? Is the concept of willpower negatively correlated with pessimism? And could providing religious practices to youth, despite the type, provide resilience to the child, even if they leave the religion later? Have doctors failed to explain the usefulness of religion to their patients with mental illness? That's a extensive question.
This is a hard one, but I'm actually an expert in this one.
You are.
So
this is perfect for you, Dr. Lavretsky.
So I serve an advisory group to the NCCH and NIH on spirituality and health. And we are trying to walk very carefully through that topic because, as you can imagine, there are pros and cons, and there are advocates and people who would protest that statement. There's a lot of literature on the role of spirituality. I actually published a book on a paper on spirituality and aging, but also in the book on resilience and aging, there's a chapter on spirituality and brain. There's quite a bit written about protective effect of spirituality. Religious practices have been studied, but there's a confound of being a community. So those who believe in a higher power tend to fare better in terms of fear of death and dying, which has been shown also during COVID. They were less affected by this really pervasive fear of death through the planet. And so there are some protective, but you have to be very careful because there's pros and cons of religious upbringing. I've spoken after I published something in an interview. I was really attacked by people who are against using religiosity or spirituality. So I have to be very careful in what I say because people have different experiences with this.
Thank you. And a question that I had, I read that during the pandemic, a lot of if we were to divide the cohorts, the younger folks actually had a higher rate of depression and anxiety than the older adults. And I think that speaks to a little bit about what you're talking about in terms of resilience and being a little bit more optimistic and having experiences. At the beginning, you mentioned we need to come together as a field and not be so differentiated and siloed as like child psychiatrists, geriatric psychiatrists, adult psychiatrists. Do you have any thoughts on how we could come together?
Well, there is an interesting phenomenon of resilience in generational resilience. Currently living generations, the most resilient generation is World War II. And all subsequent generations are less resilient, with Gen Z being the least resilient. And I feel like that's why I'm speaking here and I speak to others, and I'm holding hands with child psychiatrists because that's where you need to start. Training life skills and skills of self-regulation, breathing being one of them, should be administered in preschool. Because this is a lifelong skill, and once you have it, you could use it in every time. And I'm a yoga practitioner, I'm a yoga teacher. So in our yoga communities, there are yoga classes. That's how you prevent mental illness and all other illnesses. There are yoga classes for couples who want to conceive. So they have a conscious conception, they have all the practices. All pregnancy yoga, very popular. Pregnant moms and sometimes their partners come in. Then perinatal doula training and yoga practices around birth to reduce birth trauma for the child and mom. Then mommy and me until age 2, then age 2 to 5, and then 5 to 15, yoga classes. And these kids are bright, resilient, and calm. They sometimes run around, but they're very Parents tell them to breathe or meditate or whatever, they can switch it on off, right, like this, that's how you should start preventing illnesses.
Thank you so much. And I think that ties into another question we got. How long do you recommend doing the 3-second breathing exercise that you mentioned?
3 to 5 minutes. That's what I tell my patients, minimum. Because if you do it for, even if you stop, if everybody on the planet stopped and took a deep breath before they react, the world wouldn't be this violent. Okay, everybody stop, breathe, do not react. Even that would be beneficial. Even if you don't have time and you're in the meeting and you could just close your eyes or not close your eyes and control your breathing, just paying attention to the breath, it would reduce negative affect, anxiety, and reactivity. It would give you a pause before responding. And the response you would give, you would regret in the future. But in order to reduce blood pressure and heart rate by about 20 points, you have to breathe for about 3 to 5 minutes. 3-3-3 breaths is the easiest to learn. Longer exhale or just sigh. Or if you're in the meeting, would activate vagal response and drop the heart rate and blood pressure, and just that would be helpful, but you have to breathe. Again, our study was 11 minutes that showed really profound biological changes in the body and the brain. And many others also started looking at briefer meditations. 10 minutes seems like a reasonable time to achieve physiological response.
And that would be once a day, or do you recommend multiple times a day for 3
depending on if you're in a fire, if you're in a flood, just breathe. Yes.
This is wonderful presentation. Thank you so much. I feel personally inspired to do more of what you recommend and to figure out how we can promote and support it across the department and institute. I'm wondering, in your experience with patients, behavior change is so hard, right? What have you found most helpful when it comes to adopting some of the things that require a little bit more planning and time, such as yoga practices, behavior change to physical activity? What's been the most helpful, practically speaking, in enabling people to actually do it?
So for the audience, if you didn't hear the question, it was basically, what are some things that we can do to get buy-in for these interventions over time, such as yoga and breathing?
I work with patients and see what they prefer. It's because if I impose something on them, so I have a menu of things from different columns. Let's say music therapy, sound healing. Some prefer that. Some will go to the breathing. I recommend earthing and grounding, or even imagine if you're, let's say, a computer scientist and you work computers all day long, it's using earth element and earthing like water, washing your water from dealing with the computers, because they would introduce anxiety, and people who work with computers are very anxious usually, and that has to do with EMF and whatever else. But grounding, just imagine yourself being on the ground would have that effect. I use a lot of visualization. Like, for example, long COVID patients can't move too much, like they're so impaired. I ask them to hug a plant tree, in their house, or just connect with the tree across the street. Even that produces this conscious effort to calm down. I recommend like warm baths with bath salts, earth element, again, salts. And I send people to the beach, or if they can't get to the beach, just walk on the grass or sit on the grass. Anything nature is immediately coming. But people are so different in what they prefer and they would do. And what I do, I try to find things that they would do rather than telling them do to 11 minutes of yoga. So, and I have like, again, a menu of things. So as I said, I'm a part of the Integrative Medicine Collaborative, and the moment we're working on putting together tools for all physicians and healthcare providers to use for the healthcare system. I'm very interested in introducing, I just spoke to the medical student who wants to work on a project of mindfulness for hate project. And that's something I'm really passionate about. So we'll do that. Just doing a lot of staff education, student education. I feel like our trainees need these tools to achieve better emotional regulation.
Thank you so much,
Thank
Dr.
you.
Lavretsky. And just finally, just as a clarification for the breathing, do you inhale through the nose and then do you exhale through the mouth or the nose?
So it has a different brain effect, in fact, so so our website has actually different breathing techniques. You could do whatever you feel like. It would have a different, you could experiment. You could also, so closing, there's an alternating nostril breathing that is exists in yoga. If you're breathing through the left nostril, just by closing it or sleeping on the right side, it would be a calming effect. If you do alternating nostril breathing, it would rebalance your brain. It's recommended for ADHD. It's been studied in ADHD. And just experiment. I recommend O breathing or straw breathing where there's some resistance. This is very cooling. If you do it for 3 to 5 minutes, you'll have brain freeze.
Well, we're at 12 o'clock, so thank you so much, Dr. Lavretsky, for enlightening me with the talk. And thank you everyone for your questions in the audience.
Thank you.